Thank you very much for all of you that survived and stayed with us until the end. But I think it's worth it, at least for the Tom lecture, that wake us up, and it's worth it to stay until the end. Okay. And now I would like, some of you probably will see the results or a survey for the first time, or maybe you already get in contact on the website, and some of you with us have some knowledge even from last year. So it was actually somehow I will show you some of our results of dystonia survey that have been running this last 2 years. And I think that there is no point. We usually start with the definition what dystonia is, but you are much better expert in dystonia than we are. Just actually, we have to say, and it's important, and you know that usually all these movements, patterns, and spasm, and so on, often worsen with action and with activity. But because of all of that you heard today, and that you see the patient, that you see the different forms of dystonia and so on, it is known that dystonia is difficult to recognize due to its large phenomenological complexity. But although an underdiagnosed condition, dystonia syndromes actually represent the third most common disorder in movement disorder centers. That's which makes us much interesting in that. And first I will start with the study that we published actually in 2016. And let me say a little bit about it. This was the survey of the European Network for the Study of Dystonia syndromes that was actually supported by the COST initiative, and that we actually tried to see and explore the management of dystonia in Europe. And actually in this 24 countries have been involved. From each country you have one responder, and that one responder actually was from professionals, that means from neurologists, from the movement disorder center in that country. And in this way, we actually wanted to verify the management of dystonia syndromes around Europe and to document the management strategy, fatalities, and expertise. But let me say the results actually told us that lack of specific training in dystonia by neurologists, general practitioners, as well as other health professionals were universal in all countries in Europe we explore. But then we actually wanted to see how this, let me say, less lackage of knowledge, or let me subspecialists and special centers, how this influence the actually life of the patient, or actually the management of care and care of dystonia patient in Europe, because this should have some influence. So we wanted to investigate the management of dystonia in Europe, but from the patient experience, so that you have been the one who will tell us actually what is happening and how this lack of knowledge around Europe from neurological centers will influence your life. So we performed a survey using the first European online questionnaire to validate that this online questionnaire that was translated into 24 languages was put on Dystonia Europe website and was distributed to all dystonia patients in Europe. And data were collected from 2017 to 2019. This dystonia questionnaire actually composed of 30 questions with 3 different parts. The first part is the general question about your name, age, gender, and so on. Second part is specific questions about disease duration, type of disease syndrome, time to correct diagnosis, experience with your first visit to family doctor, and so on. And the third part actually is availability of therapy, type of therapy, side effects, quality of life, and so on. So let me say about these results that actually after these 2 years we came to the end, and these are actually the results that we presented now to European Academy of Neurology, just finished in Oslo last week. So as I told you, data were collected from 2017 to 2019, And a total of 2,858 questionnaires were received from 30 European countries. Women outnumbered men about 3-1, which actually it's already known, while the cervical dystonia was more common type of dystonia, so as you know. So in the question, what age are you? This is what I'm showing here to you. That's important will be later when we see how the care of dystonia is in Europe. And actually most of the patient fits in the age when it's the most productive and most active part of your life. That means that dystonia will affect the most active population. What type of dystonia you have, as I already told you, and we know that the cervical dystonia is actually number one, that almost 50% of patients has cervical dystonia, while 12% have generalized dystonia, and then this other type of vocal dystonia, or even actually 10% some this less frequent type, like we heard, oromandibular, hemifacial spasm, and so on. And how long you have been diagnosed as having dystonia, you can say here that we have a really expert population like yourselves, that even in more than 30% of patients have dystonia for more than 10 years. So this now comes maybe the most important question and the result. How long did it take to you to get a correct diagnosis after the first appearance of your symptoms? And here you see the first column that actually less than a year, it's about 29 or about 30% of patients, but still something that we really do not like in developed Europe, that 14% of patients actually waited over 10 years. Then from 1 to 2 years, it was 25% and about 50% from 5 to 10. This actually are disappointing results. And something strange, the question, what was your experience when you first visited your GP, your family doctors with your symptoms? In only 16% of patients, actually, the family doctor recognized the symptoms and referred me to a correct specialist, that means to neurologist. And in 21%, actually, GP did not recognize these symptoms, but referred me to a specialist. But in 23%, they did not recognize the symptoms and they did not refer. And actually, the similar study was performed by Gina and co-workers in the States, but it was involved only one center and only about 80 patients with the cervical dystonia. And even we consider cervical dystonia, it's most common, but still most easily to diagnose, as we think. And even there was actually more than 5 years waiting for diagnosis, and the mean number of specialists that they visited before was 4. So on the question, do you receive any treatment? Almost 70% of patients receive some kind of treatment, 30% not. And what treatment did you receive? You are expert today after all these lectures, and of course you know the botulinum toxin, it's most frequently used. After that coming drugs, and the DBS in 19% of patients, and very small percentage, only 4% on physiotherapy, and we don't have that, we still don't know, and that we don't have a proper study to prove the diagnosis and the effectiveness of physiotherapy. But of course, when you ask them how long did it take to receive a treatment, if you remember previous slide, how long it takes to get the correct diagnosis, of course, that they also waited very long to receive a treatment. And although we realize, and you heard from Professor Warner before, that all this plus and minus on different therapy, but still today, we can say that we have effective therapy, that we cannot cure dystonia, but the therapies are effective, and it's actually a shame that in Europe patients has to wait such a long time. So, another question, does your dystonia affect your family life? Of course, you know that almost 70%, working life 60%, social life 55%, and in 34% all aspects of my life. And of course, you know that better than me. So it's a shame that you have the disease that somehow you can treat with symptomatic therapy, and that actually you can get better and functionally better, but and that's the disease without treatment really affects your life so much. And if you remember before, why I thought that it's important, because that affects you in the most productive, active part of your life, it's actually something that we are not satisfied at all. So in conclusion, we can say that the results from this first online questionnaire have shown a long interval to diagnosis and treatment. And the data suggested the lack of training of health professionals led to delayed diagnosis and treatment that we actually retrieved from that previous study when we proved that there are lacking of neurologists, subspecialist center and specialist care in actually almost all countries of Europe. So we have to say that recognizing dystonia is important for patients because of patient treatment and quality of life, and that better collaboration of subspecialist and general practitioner education in clinical care in Europe should be considered. And so that, but it's a different when you don't have a proof for that, and somehow we hope, and really this questionnaire and the results of this survey making a lot of noise around, and we hope that will help to prove how we need to improve our education. So one of the first results actually was that European Brain Council, EBC, actually recognized the results and our efforts to make this survey and this study possible. So they wanted to have us to be included in this project that they called Value of Treatment Study on Rare Neurological Diseases. And the first Value of Treatment Study already finished, that was including some not really rare diseases, like, for example, restless leg syndrome, but now it's a turn for these rare diseases, where actually this VOT project number 2, it's including dystonia with ataxia and phenylketonuria. So for this study, we hope actually that this study started in 2018 or 19 and should be finished in 2020. Something that they want to see actually, it's health economic and cost economic analysis, and actually comparing the countries with a different level of development and different level of economics. And for the beginning, actually, we choose to compare for this study Germany, Italy, and Croatia. But we hope now that we could add and finish including in UK. In the time when we actually started, I have to say that I have been a little bit wondering about Brexit, so we didn't know how this will take and how this will affect. But now we hope to finish this earlier than any effect of Brexit, because and to see, they want to see if there is any difference that we can help in this matter of organization and health system and so on. But I have to say here it's 1,000 data, so you just saw a little bit on this short time, a little bit of analysis. But from the first point and first view, actually, we didn't find the big difference between different countries, which was a little bit surprising to some of us, even for me. I thought that Croatia will be worse than UK, but it seems that it didn't. But let's say what will be on the economical ground. So thank you very much.
Well, as you can see, gathering information helps to inform policy making and also to help launch new initiatives. without data, without information, even the most helpful doctor or politician doesn't know what direction to go into. I've got the question, Maja, in terms of your experience of the information you've got back so far on the questions, the existing questions of the survey, are you aware of any additional questions that maybe should be asked or could be asked that would actually fill some gaps that might inform sort of version 2 while still retaining the core group of questions?
Of course. I mean, the most important part here, it's a part on therapy. And it's shortage of time. I couldn't present all of this now, and still we don't have all analysis. But this part of therapy is very interesting. And actually, you could see from the survey that only 30% of patients are satisfied with treatment.
Yeah.
And then somebody today, I think Marion, when she presented botulinum toxin on something, that actually 30% drop from botulinum toxin treatment. So this is most important now, that part of therapy, to see what is happening, because we are speaking and we are satisfied with the new method, with the DBS, with it. So it will be very important to see what is happening in that.
So that very much ties in with what Tom Warner was saying. You put up a beautiful table of the treatments, but actually it really only affects a very small group, and it's really missing the point entirely. Now, I'm going to ask Adam Kalinowski to come, but as he's coming up, I would have said that a survey like this is something that would be very, very useful to have on a My Dystonia app, and I'm not sure if it is on it because I haven't checked it out, but if it isn't on it, perhaps Adam will tell us whether it's something that would be added, because the ease of access to survey instruments through an app might actually help to spring load a lot more responses. Thank you very much,
Thank you.
Maja Relja, and welcome, Adam.